Let's bring in our panel and see what they have to say. Bernard Whitman joins us, Democratic pollster, strategist, and author, who we're legally bound to say is not related to Andrew Whitman. Dominic Carter, this is a surprise here. I know many people thought separated birth. He also journalist and author and not related to Andrew. And Andrew, who's not related to a whole bunch of Whitmans, including Walt or Christy Todd. Okay, Bernard, Andrew went through the numbers here, but the one poll that doesn't say is how long. How long will the administration have to get their act together on this before the public not only just turns, but into that vacuum? You're going to have misinformation, or the GOP will fill the narrative and say, see, this is the game, can't shoot straight.
Right, so the key date is 3 months hence, and that is going to be in January when we see how many people are signing up. That's ultimately going to be the determination of how successful this effort is. And I think that we have to understand the rollout has not gone nearly as well as it could have or should have. I'm delighted that they're fixing the problems, but the fact remains that 20 million people have interacted with the website, and your report says maybe some of them were just sort of window shopping. Over 500,000 people are in some process of signing up. So there's an enormous pent-up interest and likely demand for this. We're going to have to see ultimately how many people sign up. We also have to remember, Richard, that Obamacare is a lot bigger than just the exchange and just the website. 85 million people have taken advantage of preventative coverage. 105 million people no longer have annual caps. 13 million people can get coverage now that couldn't get coverage before because of pre-existing conditions. So there's a lot of good there, even beyond the exchanges.
But you know, Bernard, now I'm starting to swim in waters a little bit deep for me on this subject, but in terms of the experts and how you can fix this, I've heard a lot of credible people say, you can't just tweak this and get this thing right. You might have to blow the whole thing up and start over again, while others say they can't even articulate who they're bringing in from the outside who's going to really be able to rehabilitate what seemed to be flawed, you know, programming, software, et cetera, to make this thing work. Can they fix it?
Well, look, I am not a technology expert, but I would venture to guess
that can we on TV?
Yeah, no, I play one occasionally on TV. Yeah. You know, I think that the fact is this is an enormous effort. We've never tried anything like this. It's hard to beta test a program for 20, 30, 40 million people. So anytime there's technological rollouts, there are going to be bugs, there are going to be problems. It happens to Microsoft, it happens to Apple. It's going to happen here. But those pink kinks, I believe, will be solved. And we're going to have to look come the new year about how many people actually got a chance to sign up.
But we mentioned deadlines, Dominic, and the administration right now, they're in a box, because if they flinch at all here, and said, we're going to push back the deadlines to make these exchanges, you know, you got to sign up by X date. Now they're opening up Pandora's box, and Republicans are going to be like, now let's revisit the employer mandates. Let's go through all these different things. They got to hold the line, but, I mean, we credibly got to ask in a few weeks here, if they don't have their act together, can you fairly ask the consumer, the American public, that they have to sign up for something that's not working by a certain date here? You got to give them a fair opportunity to shop and compare. It's beat the clock time for the administration.
We're already seeing some chinks, if you will, in the armor, where one or two Democrats are saying, hey, you may have to push that deadline back. That's a dreaded no-no. They don't want to have to go there, as you said. But I am glad, to your point, that you pointed out that several other initiatives already underway are working very well. But the problem, Richard,
nobody's going to hear about that.
Right. And, you know, they're playing right into Republican hands.
And they can only hope Republicans are going to save them so many times, like they did with the government shutdown, the debt limit. Took 2 weeks of attention off this. If they just quiet Republicans, they'll do themselves a favor. But, Andrew, there's always a scapegoat. In every political, whether it's a scandal, whether it's a pathetic rollout, whatever it is, you think Sibilia survives here? The president wants to stand by her, but at a certain point, the stink doesn't stay with her, it carries to him.
I actually do think that Sibilia survives this thing. I think the Obama administration has to circle its wagons when it comes to the whole health care rollout. And much like you're talking about moving targets and deadline days, if they do that, that's pretty much an admission that this thing is in trouble. If they give up the head of the Health and Human Services Secretary, it's a similar admission. If she goes, you can open Pandora's box. First of all, how are you going to get somebody to confirm to replace her?
Well, they've already brought in folks, including Jack Lew's successor, to kind of take point on all of this here to run the show. That said, though, they made it clear this is her baby. And while the administration says the buck stops here, they're still going to put her out. She's going to Congress next week.
Yeah, and she's going to have some tough questions to answer, and I'm sure that will play a significant role in whether she stays or not. But
fair enough, Bernard. Politics always plays a role in this thing. We just talked about how it's been a horrific last month for Republicans. But how should they play this thing? And if they read the American public the right way, can they go beyond just inquisitor here and start demanding that, hey, the thing's not working, you have to push back the deadlines? How far do they push without pushing too far?
Well, far be it for me to give advice to Republicans, but the Republicans did a wonderful job of boosting support for Obamacare during the government shutdown.
From a Democratic pollster, what do you hope Republicans do that'll buy more time for this administration?
I hope they keep on trying to defund it, because the American public is done with it. This law is a law of the land. It's been upheld by the Supreme Court. They would like changes to be made. They would like Republicans to work with Democrats to improve the law. But the notion of somehow trying to defund, dismantle, or disregard the Affordable Care Act is something that the American people are fed up with and they don't want it. So frankly, I hope the Republicans keep on that tack. Now, in terms of effective governance and moving this program forward for the benefit of the American people, I would hope that we could engage in bipartisan dialogue. I think that one of the big sticking points, frankly, has been the medical device tax. I think there's bipartisan support to repeal that. We'd have to, of course, come up with the $30 billion that tax throws off. But if we can engage in those conversations where there's bipartisan support, then perhaps we can actually get the program moving forward
if
together.
They're smart, what they'll say is, they'll say, hey, listen, we fought the fight. We're not going to try and defund Obamacare. We know it's a losing fight. But because the system's so flawed, we have to do this. And they'll start with the medical device tax, and then they'll lump other stuff.
Richard, if they're smart, they won't say anything. If they're smart,
that ain't gonna happen.
Right, that ain't going to happen. If they're smart, Republicans will get out of the way and let this thing continue to make mistakes and let the media take the point on this. If they can do that and keep their mouths shut, they may be okay.
But they have never demonstrated a capacity to do that. They always overreach. They always take it too far, and they misunderstand their votes. They misunderstand it for a mandate.
The more that they do complain about Obamacare, the more it sticks out there in the general public's mind that this is somehow flawed.
See, I'm with Dom, though. CNN, you turn on CNN, Andrew, they basically spend half the day beating on Obamacare. They're doing the job for the Republicans. The Republicans do it to look politicized.
The politics of this aren't going to kill Obamacare. What's going to kill it, if it's going to die, is going to be a lack of the needed number of people signing up for it to make the system work. There's a set number of young people, of young, healthy Americans who have to sign up to make the numbers work out. And if they don't get that number involved, the entire thing will topple on itself from too much cost. If you really want to kill Obamacare, that's the way to do it. So you may as well keep throwing dirt on it and trying to keep people from signing.
I'm with you, and I also think right now the other story that comes out isn't just that it's hard to access the site. You're hearing human, tangible stories about people saying, wait a minute, I checked out Obamacare versus my existing plan if you're healthy and you don't have a pre-existing condition. And a lot of people are saying, you know, the Obamacare plan is going to cost me more out of pocket than what I'm paying right now. That's not what I thought. That's not what I was told to believe.
I don't think that's the typical story. I really don't.
I'm telling you, whether it's fair or not, that's the story that's getting played out in the media, because everybody's in the media. This is how our game is. Everyone's afraid that they've beaten up on the Republicans so much for the last month. They're killing themselves doing backflips to try and look balanced. So they're attacking Obamacare fairly or not.
But the facts of the matter, here in New York State, costs for most people under the exchanges will be half of what they might pay in the outside market. Now, is that going to be replicable across the country? Probably not. But here in New York State, which is a pretty large state, covers tens of millions of people, a lot of people can save a lot of money.
Last question. Fairly, I think, a criticism before even the rollout was the president and his administration never effectively sold why this was good and how this would change. We did historically, Bernard, some of the same dialogue that went when LBJ was trying to get through Medicare, when FDR was trying to get through Social Security. You could have cut and pasted the comments from opposition then and now. But at least those presidents sold hard, and they really marketed why these programs were good for America. The president didn't do that. Does the president, at the same time he's trying to convince the people that they're going to make the thing work, can he sell its virtues here in the meantime? Or does he have to wait to see first you can click on and get in?
I think in some respects the virtues do speak for themselves, but we have to socialize it more. 85 million people have taken advantage of free preventative care under Obamacare. That is going to save tens of thousands of lives per year. And the more stories that get out like this, and the more stories about how kids up to 26
what you just said is more than I've heard the president say.
Well,
so that's part of the problem.
If the president is listening, he should repeat that.
All right.